Hi, my name is Marta Anderson, and today we are doing a horse health check demonstration. First of all, I want to go over the horse's general appearance. Here I have Stephanie, my handler, and Winston, my horse. First thing I want to note when I go to look at my horse is, are his eyes bright? What does his expression look like? Is he alert? If this is normal for him or if this is not normal for him. Another thing I want to go over is what the rest of my horse looks like. So as you can see, he has shine to his coat, which is his bloom, indicates that he's getting good nutrition. And then I want to do a hands-on check, run my hands over him and check for any new injuries or scrapes. As I do this, I'm going to have my handler Stephanie change sides with me so that we're on the same side and can stay safely out of kicking range. So basically I'm feeling for any new scrapes that I'm not aware of, looking for any injuries that he could have got in his stall, feeling for any abnormal swelling or heat in his legs, and seeing if he has any sensitive spots that I might not be aware of. I don't feel anything on this side, so I'm going to check the other side. If I can have Stephanie turn him for me. All right. So what I'm feeling for is that the tendons are tight and that they don't have any abnormal filling between them, that he isn't sensitive anywhere, that there are no wounds that I'm not aware of. And Winston looks good. So for my first appearance, I'm going to say Winston's healthy, but there are other checks that we can do that we call our vital signs. These are tests that I'm going to run on Winston to check his overall health. The first vital sign, and probably the easiest one that I'm going to demonstrate, is our skin pinch test. For this, I take the loose skin right here on his neck, and I'm going to pull it away just enough that it tenses. Then I'm going to release it, and it should snap back to its original position. This is a test for hydration. So what I do, pull it up so it tenses, release. It should snap back within 1 to 2 seconds. If it's longer than this, I will be concerned about Winston's hydration, unless he's an older horse where the skin loses some of its elasticity and takes longer to go back to its normal shape. This is one of the reasons why you should be doing a daily check on your horses, so that you are aware of what is normal for them and what's not. If it's normal for Winston's skin pinch to take 3 seconds, I shouldn't be alarmed at 3 seconds. But if it's not normal, then I should be concerned about his hydration. Another way to check his hydration is the capillary refill time. I check this at the mucous membrane on his gums. What I do, let him know that I'm coming, and I'm going to lift his lip up so that I can see his gum, and I'm going to press my thumb down until the area blanches out, and then release and count how many seconds it takes for the area to fill back in with blood. So here I'll press and then release. And that took about a second. So this is what I'm looking for. It should be 1 to 2 seconds. Any longer than this, and I will have concerns about hydration. Now, while we're talking about the mucous membranes, there are other things I can look for as well. If you can see Winston's mucous membrane here, it is shiny, slick, and moist, and has a healthy pink color. This is ideal for a healthy mucous membrane. If I had a color like yellow, I would be concerned about liver problems. If his mucous membranes were white, I would be worried about shock. Fire red can be an indication of fever or some kind of infection, and a bluish to dark brick color can be a sign of anemia or lack of oxygen. The other place that I can check Winston's mucous membranes is the conjunctiva of the eye, right inside the eyelid. Now, I'm not actually going to pull his eyelid down because this is uncomfortable for him, but if you were to check his eye, you would place your index finger above his upper eyelid, and then you would take your thumb below and you would spread his eye open and look right along the lining inside his eye. That is another place to check the mucous membrane, but it's usually easier to look at the horse's gums first. The next vital sign that we're going to check is the horse's pulse. The normal pulse for the horse is 32 to 44 beats per minute. How I'm going to check the pulse is to find a main artery, which we can use the maxillary artery or the radial artery. I'm going to find the pulse with my fingers, and then I'm going to have my videographer, Ashley, time while I count. She's going to time for 15 seconds, and then I will take the number that I get and multiply it by 4 to find how many beats we have in a minute. So what I'm going to do, find our artery here, wait till I can feel the pulse. Okay, I have it.
Go. Time.
What I got was 9 beats, so when I multiply that by 4, I get 36. This falls within the normal range. If I had a number that fell above the normal range, I would be concerned about something like a pain response or the horse being overly excited or agitated about something, but generally it's an indicator of pain. If I had a really low pulse, like below 32 beats per minute, I would be concerned about something like shock. Now I'm going to demonstrate how to take the radial pulse. What I do is I let Winston know I'm here. My handler is going to stay on the same side as the horse, so when I kneel down I can be safe from being kicked. And I'm going to keep both feet on the ground and not put my knees down. Then I'm going to find the inside back of the knee. There's a soft spot right here where you can find the pulse, and I'm going to push down and release until I can feel it, and then Ashley's going to time for me again. Okay, I have it.
Go. Time.
What I had here was 9 beats. When I multiply that by 4, it is also 36. This is a result that I'm going to expect because I got 36 up here as well, and it's the same horse, and considering that the circumstances haven't changed, I expect him to have the same pulse. The final pulse I'm going to check is the digital pulse. This is down here by the fetlock and along the back of the pastern. This pulse is generally much harder to feel, and that's a good thing. It's usually indicative of a problem in the horse's hoof. So while I am going to try to find it, chances are that I will not be able to feel it because I don't think there's anything going on in Winston's feet. So what I do is I kneel but keep my knees off the ground. I'm going to run 2 fingers down till I find the soft spot along the fetlock joint here, and I'll feel and see if I can feel anything. I can't feel anything at this first point, so I'm going to move my hands down to this groove down here and see if I can feel anything lower down. I can't feel anything down lower either. This is not surprising because, as I said earlier, I don't suspect anything is wrong in Winston's feet. If I did feel something, this could be indicating founder or something painful like an abscess. In this case, if I felt a digital pulse, then I would immediately look to the hoof for the problem. The next thing I'm going to check on Winston is the heart rate. Can I have this? Yes. I don't have that. Thank you. So to check the horse's heart rate, I'm going to use a stethoscope because the horse's heart is slightly to the left side of his body behind the elbow. So the easiest way to check it is put the stethoscope right behind his elbow and listen in there until I can find it. I'm going to check this the same way as the pulse. My videographer Ashley is going to time once I can hear the beats consistently. And sometimes it takes a while to find the heart rate, so you just have to be patient. Okay, I'm ready.
Go. Stop.
All right. Again, like the pulse, I got 9 beats. When I multiply that by 4, because we timed for 15 seconds, I will get 36 beats per minute. This is a good thing because it falls within the normal range and it was the same as the pulse that I got earlier, which is a reflection of the heart rate. Again, if the heart rate is high, I will think that Winston may be in pain, and this is an indicator. If it's low, I might consider shock as a problem. The next thing that I want to check is Winston's respiration rate. The normal respiration rate for the horse is between 8 and 16 breaths per minute. It should always be lower than the heart rate, even at exercise. The first thing I want to say about checking the horse's respiration rate is it's easier to check looking at the horse's flank rather than watching their nostril. And here's why. If I take my hand and put it in front of Winston's nostril to see if I can feel the breath, he may be curious and sniff me, and this will throw off my count so that I do not get an accurate breaths per minute. So what I'm going to do instead is place my hands on Winston and watch his flank. Now, it's easier if you watch and you keep a hand on him because it kind of helps you follow him if he moves, and it also helps you feel the movement rather than just see it. Because the breaths per minute are lower than the heart rate is, I'm going to time for 30 seconds because this will help me get a more accurate number. So once I can see consistent breathing, I'm going to have Ashley time for me again. Okay.
Go. Stop.
What I saw was 4 breaths. 4 breaths within 30 seconds is 8 breaths per minute. This falls at the low end of normal, which is okay. Winston is very relaxed, and so I would expect him to fall at the lower end of the range, and I'm not concerned about this at all. If the breaths per minute are higher than the heart rate, this is called inverse respiration, and this is a very serious condition. If you see something like this, you should call your vet immediately. The next vital sign that I'm going to check are Winston's gut sounds. I'm going to check in 4 quadrants. I'm going to check the high quadrant and the low quadrant on each side. It is important that I check all 4 because there are varying degrees of activity in the horse's intestines. The high quadrant may be completely quiet, while the low may be busily working along and happy. It's important that I know what is going on in each one. The sounds that I'm listing for are gurgles, squeals, and rumbles. These are indications of food moving through the digestive system properly. The sounds that I do not want to hear are rushing, which is hypermotility. It sounds like running water. This could be an indication that the horse's digestive system is trying to get something out as quickly as possible. Another sound that is concerning is the sound of gas colic. The best way to recognize this is it's a pinging noise, or it sounds like somebody is dropping marbles or pebbles down a metal pipe. The final sound I don't want to hear is no sound at all. This could be an indication that the horse's intestines in that section have shut down. This can be very dangerous, as food can ferment where it should not, or it can be an indication that a section of the bowel has died, which is a very serious condition. As I check the gut sounds, I'm going to have Stephanie be on the same side as me, so if there is anything tender in here and he tries to kick at me, she can pull his head towards me and it will send his hind end away, which will keep both of us safer. Second, I'm going to keep my hands on him, so if he moves, I can kind of follow him and move with him. So I'm going to check high, right back here behind the rib cage. And I can already hear healthy gurgles and squeals, so this makes me happy. And then when I check lower down, I'm going to let Winston know that I'm going to press my ear to him so he's not surprised. Okay, I can hear healthy gurgles in both quadrants on this side. This makes me happy, but I also need to check the other side to make sure that he's good as well. As I'm changing sides, Stephanie changes with me because he may be sensitive on this side and I want to make sure that we are both safe. Once again, I'm going to press my ear up against him and just listen for healthy sounds. I'm already hearing good, healthy gurgles. This is a good indication. Now I'm going to listen to the bottom quadrant on this side. And again, I hear healthy gurgles on the bottom quadrant. It sounds to me like Winston's intestines are happy and healthily working along. Gut sounds can change depending on the time of day and when the horse last ate and what he last ate. But you should check these regularly so that you know what is normal for each individual horse. The final vital sign that I'm going to check is Winston's body temperature. What we have here is a digital thermometer. I can also use a mercury thermometer. If I'm using a mercury thermometer, I have to shake it down well below 98 degrees before I take his temperature so that I know I get an accurate reading. With a digital thermometer, you just insert it into the rectum and wait until it beeps. The difference between the digital and the mercury thermometer is after you shake the mercury thermometer down, you have to wait for 2 minutes before it actually reads the horse's body temperature. They're also slender and it's easier to lose the mercury thermometer inside the horse. So it's very important that you have a string attached to it and a clip on the end so that you can clip it to the horse's tail and wait until you get the accurate reading. Now it's important that you lubricate it before you insert it. This is for the comfort of the horse so that he doesn't dislike the procedure in the future. So I'm going to get the thermometer gooped up and turn it on. Then what I'm going to do, I'm going to let Winston know that I'm here so he's not surprised and so that he doesn't feel like he needs to kick me. Then I'm going to gently lift his tail up and away. And when I insert the thermometer, I don't want to stick it straight in. I want to kind of angle it towards the side of the anus. This will make the metal part on the end that's reading the temperature read his actual body temperature so that I get a more accurate reading. With a digital thermometer, you generally leave it in for 2 minutes. You should have a string attached to it and a clip so you can clip it to its tail so that it doesn't disappear in there. With a digital thermometer, they're usually faster so that you can hang on to it, but you do have to be patient and wait until it beeps to get an accurate reading on the temperature. So I'm just going to wait until I hear this thermometer beep. What I'm looking for is an average temperature range between 99.5 and 101.5. Anything above 102 is considered a fever and can be an indication of infection or pain or some kind of illness. So I'm just going to wait until it beeps here. And what I got is 100.6. This is a normal range for the average equine. And for Winston, this is his average. It is important that you check all of the horse's vital signs when you suspect something, because if you just check one and it's good, he may be showing that he's in trouble somewhere else, and if you ignore this, that is not going to be helpful to him at all. Now when you clean the thermometer off, you wipe it off with a towel or a rag, but then before you use it on another horse, you should wipe it off with rubbing alcohol so that you don't transfer any germs or spread any infections. Today, the vital signs that we went over for our general horse check, we went over the bloom of their coat, how bright their eyes are, what their expression is, and what is normal for them. Then we went over their hydration, which we can check through the skin pinch test or the capillary refill time. Then we can check them systemically by looking at their mucous membranes and noting the color and how shiny it is and how slick and smooth it is rather than tacky or sticky. And then we checked Winston's pulse and heart rate. We checked right under the jaw, right behind the knee, and right on the other side on the base of his chest for his heart rate. The next thing we checked was Winston's digital pulse, which I could not feel, and generally you can only feel if there's something wrong in the feet. And then we checked Winston's respiration, which should always be lower than his heart rate. We moved on to checking his gut sounds, which should be happy, healthy gurgles. You should not hear hypermotility, which sounds like rushing water, or gas, which sounds like a pinging noise. Then we checked Winston's body temperature, which should be 99.5 to 101.5. Any higher is an indication of fever or pain. Thank you.